Welcome to the National Diabetes Prevention Program, Diabetes Prevention Recognition Program, Data Entry and Submission webinar. Changes in data collection. The Diabetes Prevention Recognition Program, DPRP, standards and operating procedures are reviewed and revised every 3 years to ensure alignment with the latest science of type 2 diabetes prevention. The 2021 DPRP standards include changes to variables collected in the required biannual data submission. New variables added include cohort ID, COACHID, A1C, enroll MOT, enroll HC, payer source, and gender. Changes in data collection part 2. Several variables have been removed or renamed. The DPRP will no longer collect the CES ID variable. The enroll variable has been removed and replaced with enroll MOT and enroll HC. Payer has been renamed payer source to reflect the new numbering options. As a result of removing the CES ID variable, the coding for CES type has been updated to include MU-C, MU-CM, and MU-OM to capture where a participant is in their timeline when making up a session. COACHID details. The new COACHID variable is a unique identifier that is assigned to an organization's trained lifestyle coach or coaches. The ID is created and maintained by the organization, must not contain personally identified information, and must follow the parameters outlined in the DPRP standards, such as the maximum length of the variable. For those organizations delivering the MDPP, please use the National Provider Identifier (NPI) number as the COACHID for these lifestyle coaches. Before uploading and submitting a CSV file with COACHIDs entered, organizations are advised to first enter the COACHIDs into the Coach section of the Organization Profile module in the DPRP Data Submission portal. During the month data are due, organizations will be required to confirm their COACHID entries before accessing the Submit Evaluation Data module, but DPRP strongly recommends confirming they are accurate before uploading a CSV file, even if it is prior to the submission due month. It is generally expected that COACHID will be the same for all sessions for all participants assigned to the same cohort ID. If a new coach takes over a cohort, please enter the new COACHID. It is not necessary to report a change in coach if it's temporary. Entering HbA1c. A1c is a new optional variable under the 2021 DPRP standards. In order to use HbA1c reduction as a way to show reduction of risk for developing type 2 diabetes, there must be a pre-intervention measure and a post-intervention measure. CDC requires that the pre-intervention measure be no older than 1 year prior to the start date of the program and no later than 14 days after the start of the program. If a participant has a test done during that time period but does not get the result until after the time period, it can still be recorded as being associated with the first session. Pre-intervention A1C entries must be in the pre-diabetes range of 5.7 to 6.4 and should have a corresponding glucose test entry of 1 so that the participant can be deemed eligible on a blood test. Having the blood test performed after the time period and retroactively associating it with the first session is not allowed by the DPRP. CDC requires that the post-intervention measure be the result of a blood test performed during months 9 through 12 of the program. This measure cannot be submitted to the DPRP after completion records for the participant have already been submitted. Organizations may enter the default value of 999 between the baseline and the final measure, or for all sessions if HbA1c will not be used to show the participant's risk reduction. Additionally, the default value can be used if final measurements are not collected or a participant does not complete the program. While pre-intervention measures must be in the pre-diabetes range, post-intervention measures do not. If this measure falls below pre-diabetes range, that's great news and should be reported. Please note that the DPRP will not allow for retroactive adding of HbA1c values on previous data submissions. Data preparation coding sessions. Correctly coding sessions will reduce the number of errors during the validation process. The initial 6-month period is the core phase, during which a minimum of 16 weekly sessions are offered over a period lasting at least 16 weeks and not more than 26 weeks. All sessions held during this phase must be coded as session type C or MU-C if it is a makeup. The initial 6-month phase must be followed by a second 6-month core maintenance phase, which requires that at least one session be offered each month for a minimum of 6 sessions. All sessions held during this phase must be coded as type CM or MU-CM if it is a makeup. Any sessions attended after the initial 12-month program are considered to be ongoing maintenance and must be coded as session type OM or MU-OM if it is a makeup. Cohort timeline. While submission timelines are determined by an organization's effective date, which will be discussed in more detail in a few minutes, evaluation timelines are specific to the cohort. All participants assigned to the same cohort ID will adopt the start date of the cohort even if they start late. This means all the participants with the same cohort ID will have the same core first 6 months, core maintenance second 6 months, and ongoing maintenance beyond the first 12-month timelines. For example, cohort ID ABC123 had its first session date on May 3rd, 2021. This means the first 6-month core timeline for the cohort goes from May 3rd, 2021 to November 2nd, 2021. The second 6-month core maintenance phase goes from November 3rd, 2021 through May 2nd, 2022, and the ongoing maintenance phase would start on May 3rd, 2022. The DPRP will not include a cohort in an evaluation until a full 365 days have lapsed since the cohort's first session date. Cohort timeline special guidance. Given that the core maintenance, and ongoing maintenance timelines are now based on the cohort's first date rather than the participant's first date, allowing a participant to start late can cause unexpected results. Late starting participants will adopt the timeline of the cohort, even if this results in a participant having less time to complete the program. The later a participant joins, the less time they have to meet evaluation criteria and program requirements. The DPRP strongly recommends that organizations do not allow participants to start more than 2 weeks after a cohort effective date. Alternatively, organizations may use the participant ID, particip, as the cohort ID for those who start late. This approach is also recommended for organizations that have rolling enrollment. These participants will be treated as a cohort of 1 and will have individual timelines. Continuing with the example of cohort ABC123, the cohort's first session was on May 3rd, 2021, but a participant starts late on June 2nd, 2021. If the organization uses the cohort ID, the first 6-month core timeline for the participant still ends November 2nd, 2021, as the cohort started on May 3rd, 2021. The second 6-month core maintenance timeline still ends on May 2nd, 2022, and the ongoing maintenance phase would still start on May 3rd, 2022. In this scenario, the participant's timeline would be the same as the other participants in the cohort, and they would only be in the program for 11 months. If an organization uses the participant's ID, particip, as the cohort ID, the first 6-month core phase will start on the participant's first attended date, June 2nd, 2021, and go through December 1st, 2021. The second 6-month core maintenance phase will start December 2nd, 2021, and go through June 1st, 2022. The ongoing maintenance phase will start on June 2nd, 2022. In this scenario, the participant's timeline would be offset from the other participants in the cohort. that they would have the opportunity to attend the program in its entirety. Again, the DPRP does not recommend organizations allow participants to start more than 14 days late. But if an organization chooses this route, DPRP recommends that the participant be placed on an individual timeline.
Data Preparation 2021 Data Template, Example CSV File, Part 1. Once an organization is granted DPRP pending recognition status, organization will be sent the data entry spreadsheet template. As a result of the changes in data collection per the 2021 DPRP standards, changes have been made to the DPRP data template as well. Across the top of the spreadsheet is the list of variable names that correspond to the data dictionary in Table 4 of the 2021 DPRP standards and operating procedures. Please refer to the data dictionary for an explanation of each variable and a list of valid entries. No other variables should be added and no variables should be deleted. Existing variables names and the order in which they are presented should not be changed. Any changes to the columns will cause an upload failure and system errors. Data Preparation 2021 Data Template, Example CSV File, Part 2. In the spreadsheet, each row represents one session attended by one participant. If a participant attends 20 sessions, then there should be 20 rows of data for that participant. If the participant did not attend a session and did not attend the makeup for that session, then no record should exist in the spreadsheet for that missed session. Continuing with the same example, participant A1 is assigned to cohort ABC123 and attended their first course session on May 3rd, 2021. The initial HbA1c level is recorded as 5.9. The initial weight is 256 pounds, and the initial reported physical activity minutes is 0. All records for all participants in all cohorts collected during the data collection period should be included on a single spreadsheet. Please do not attempt to submit separate spreadsheets for different cohorts or for separate participants. Data Preparation 2021 Data Template, Example CSV File, Part 3. Some information collected for participants is not expected to change throughout the participant's time in the program. For example, our code, particip, cohort ID, enroll MOT, enroll HC, payer source, state, age, ethnicity, race, sex, gender, height, and education should all remain the same for session to session. If a participant changes the state of residence during the program, it is appropriate to update state. Age should always be the age reported at enrollment. Please do not update the entry if a participant has a birthday. The DPRP recommends copying and pasting these values to reduce typing errors when data is entered for the same participant. Data Preparation 2021 Data Template, Example CSV File, Part 4. Some information can or is expected to change over time. For example, block test, GDM, and risk test can change if participant eligibility changes. For example, if a participant enters the program on a risk test and later reports receiving blood test indicating prediabetes, the value for block test would change at the session the updated value is reported. See the updated entry on May 24th, 2021. If a participant is no longer eligible for the program due to becoming pregnant or developing type 2 diabetes, entries for blood test, GDM, and risk test would be changed to 2. These participants may continue the program at the discretion of their doctor, but their data will not be included in any evaluations. As noted previously, this participant provided a baseline HbA1c entry of 5.9, which is captured in the first session record. Other sessions reflects the default value of 999. Remember, A1C values are only required if A1C reduction is being used to show reduction of risk for developing type 2 diabetes. The D mode variable indicates the session level delivery mode and should only change for makeup session or if the organization has reported using a combination delivery mode. In this example, the participant attended a makeup session on May 20, 2021 using distance learning. Note the change in D mode to 3 and the change in sys type to MUC. Also, a different lifestyle coach delivered the content for this makeup session, so the coach ID has changed. Date, weight, and PA should change at each session, with a few exceptions. Date should always reflect the date on which the participant attended this session or completed the model. Weight should reflect the weight measured or reported at the session. And PA should reflect the total number of reported physical activity minutes performed in the week prior to the session. Please note that the DPRP portal will not accept height and weight measures in decimals. All values must be whole numbers. If decimals are included, the entries will be flagged as errors. Data submission timeline. As previously stated, once an organization has been approved, the DPRP will send a data submission and evaluation timeline specific to the organization. There are a few important dates to keep in mind. The approval date is the date an application was approved. The effective date is the first day of the month following the approval date. Organizations will submit data every 6 months starting from this date. Organizations may start offering sessions on or after the approval date and must begin within 6 months following the effective date. If an organization cannot meet this requirement, then that organization may withdraw from the DPRP and reapply after a mandatory 6-month waiting period. Data submission timeline example. Here is an example of a submission timeline. The organization's approval date is February 7, 2021, making the effective date March 1st, 2021. This means the first submission is due in September 2021, which is 6 months following the effective date. This first submission should include all records collected between the approval date through the last day before the submission due month, August 31st, 2021 in this example. The second submission is due 6 months later in March 2022 and should include all records collected from September 1st, 2021 through February 28, 2022, picking up where the first submission left off. The third submission will be due in September 2022 and should include all records collected from March 1st, 2022 through August 31st, 2022, picking up where the previous submission left off. Please do not include session records that have already been submitted and do not include session records that are not yet due. Cohort timeline versus submission timeline. This graph illustrates the data submission timeline example using cohort ABC123 and illustrates how it moves through the program based on the organization's effective date. Again, the organization's effective date is March 1st, 2021. However, the first cohort did not start until May 3rd, 2021. In September 2021, the first required 6-month data submission is due but does not line up with the cohort's 6-month timeline. This is okay and will most often be the case. In the first submission due month, an organization will submit anything that has been collected since the approval date, even if it is only 1 or 2 sessions. In this example, in September, the organization will submit everything collected since the cohort's first session date on May 3rd, 2021, even though the core phase is not yet complete. In March 2022, the organization will submit the records collected from September 1st, 2021 through February 28, 2022. This will include the rest of the cohort's core phase and part of the cohort's core maintenance phase. In September 2022, the organization will submit all records collected from March 1st, 2022 through August 31st, 2022. This submission will include the final core maintenance records for the cohort that started in May 3rd, 2021. This third submission in September 2022 is when the participants will be evaluated, if eligible, as 365 days will now have passed since the cohort's first session. More on this later. Data submission reminders. The DPRP will send 2 email reminders for the required 6-month data submissions to the program coordinator, secondary contact, and data preparer. The first reminder is sent approximately 1 month before the data submission is due. This email is to ensure organizations are aware that the submission is due soon, but no immediate action is required. A second reminder will be sent about 2 weeks into the month in which the submission is due. Continuing with our example, the organization has data due in September 2021, so the first email reminder will be sent around August 1st, 2021. The second reminder will be sent around September 14, 2021. Please note, the second reminder goes to all organizations with data due, even if the file has already been submitted. If an organization has already made their monthly submission, they may ignore this second reminder.
Data submission process. DPRP submission data cannot be submitted via email. The data must be uploaded and submitted in CSV format through the DPRP Data Submission portal. Organizations must have CDC's Secure Access Management System, SAMS, registration to access the portal. If an organization does not have SAMS access, then they can submit a case to the National DPP Customer Service Center to request access. Organizations will upload, validate, and make basic corrections to the data file before being able to submit to CDC. Please note, uploading a file is not the same thing as submitting. Organizations may upload and start correcting data files at any time, but will not be able to submit until the first day of the submission due month. In addition to submitting data, the updated DPRP Data Submission portal now also includes multiple modules in which organizations will enter, confirm, and correct other types of information. These modules are program delivery, contacts, coaches, and public class locations if applicable. Organizations can make changes to this information anytime, but will be required to confirm or update information in the modules during their submission due month. The Submit Evaluation Data module will remain unavailable until confirmations are complete to ensure organization information is up to date. Data Submission Process Part 2. A successfully uploaded CSV file will have the status validated, but again, uploading a file is not the same as submitting it. The DPRP will not receive the file until it has been submitted. The number of total errors and required confirmations must be 0 for the Submit to CDC button to activate. Quality checks, which are flags that alert organizations to something that should be double-checked for accuracy, do not have to be cleared in order to submit because they are not considered to be errors. However, clicking the Submit to CDC button indicates an organization has reviewed the quality checks and confirmed the entries are accurate as entered. When performing additional review, the DPRP will assume this has been done. Organizations will know the submission is successful because the status of the file will change to submitted, and organizations will receive a submission confirmation email. Please note, once a file is submitted, it will no longer be available for editing or deleting. If corrections are required, whether due to the result of a DPRP review or due to an organization finding an error, The DPRP data team will reject the submitted file, and the organization will upload and submit a corrected file on the All Files page. If an organization makes edits within the portal, each time the file is revalidated, the portal saves an updated copy of the CSV. Organizations can download this file and save it for their records, or use it to make further corrections and prepare to submit. The link for this file is on the data profiler and is named Last Validated File. Data Submission Process Part 3. After receiving a submitted file, the DPRP data team will perform additional data checks for potential issues that are not identified in the portal. If additional corrections are needed, the DPRP data team will send an email alert that the file has been reviewed and requires the attention of the organization. Organizations will then log into the portal to see details and instructions on how to proceed. Data resubmissions and/or inquiry responses should be received within 2 weeks. The DPRP will send a reminder after 2 weeks, then a final reminder after an additional week. If no response is received after the final reminder, your organization risks losing recognition and being removed from the DPRP registry. Organizations may request technical assistance with data submissions by emailing dprpdata@cdc.gov. When ready, the file will be accepted and the DPRP data team will send a notice that the progress or evaluation report is ready for viewing and download. The report will be uploaded to the portal and will be accessible by the program coordinator, the secondary contact, and the state quality specialist.
Evaluation process, eligible participants. Participants will not be considered for evaluation until at least a full 12 months, 365 days, have lapsed since the cohort's first session date. Multiple cohorts will be evaluated together if they started in the same 6-month period, which the DPRP refers to as a sequence. In addition to a lapse of 365 days from the first session date, to be eligible for evaluation, participants must be at high risk for developing type 2 diabetes. This is determined by blood glucose test within the last year. A positive screening from the pre-diabetes risk test provided by the American Diabetes Association, or history of gestational diabetes, or GDM. In addition, the participant must have a qualifying body mass index value of 25 or 23 for Asian Americans. Additionally, participants must have attended 8 sessions in months 1 through 6 and have at least 9 full months between the cohort's first session date and the participant's last session date at the time of evaluation. Evaluation process, cohort timeline for participant evaluation. This graph illustrates in general which participants, if any, will be evaluated at each submission. Evaluations are performed on participants enrolled in cohorts where the cohort's first session date is at least 1 year, but not more than 18 months before the submission due date. If a program's first cohort begins in sequence 0, the time between the approval date and effective date, then sequence 2, the 12-month point in the timeline, is the first time the DPRP can do a full evaluation. In this case, all cohorts that started in sequence 0 may be evaluated when the 12-month data file is submitted if it benefits the organization. All cohorts that started in sequence 1 will be evaluated in sequence 3. All cohorts that started in sequence 2 will be evaluated in sequence 4, and so on. Evaluation process, example. Continuing with our example, no participant started during sequence 0 between the approval dates, February 7, 2021, and the effective date, March 1st, 2021. In sequence 1, cohort ABC 1 to 3 began on May 3rd, 2021. No evaluation is performed at the sequence 1 submission, as it is not possible to have completed 12 months of the program. Because no participant started in sequence 0, there is also no evaluation performed at the 12-month sequence 2 submission. At the 18-month sequence 3 submission, The eligible participants from cohort ABC 1 to 3 from sequence 1 will be evaluated. No participants started the program in sequence 2, September 1st, 2021 through February 28th, 2022. So no evaluation is performed at the 24-month sequence 4 submission in March 2023. To track and understand when participants will be evaluated, it is important to understand in which sequence the participants assigned cohort ID begins. This concludes this presentation. Thank you for participating in the Diabetes Prevention Recognition Program.